Good evening, all. My name is Simiran Choudhary, and I welcome all the viewers and speakers on behalf of Voice of Healthcare. And thank you all for joining in for the panel discussion on Embracing Pink Beyond the Ribbon. Virtual Awareness Initiative for Breast Cancer Awareness in India, organized by Voice of Healthcare and co organized by Pfizer. The initiative Embracing Pink Beyond the Ribbon signifies our collective efforts to talk and raise awareness throughout and not just on recognized awareness days. We all know breast cancer is the most common type of cancer amongst women in India. According to World Health Organization, breast cancer caused 6,70,000 deaths globally in 2022. Roughly half of all breast cancer occur in women, with no specific risk factors other than sex and age. Approximately zero point 0.5 to 1% breast cancer occur in men. With this panel discussion, we, with our esteemed speakers, aim to raise awareness and educate public in layman's language about what is breast cancer, who is at risk, signs and symptoms, timely diagnosis, advanced treatments, and the challenges and disparities in access to breast cancer care to underdeveloped areas. Now, I would like to introduce our esteemed speakers for the panel discussion. Dr. Lovenish Goyal, Head of Department Oncology at Aadhar Hospital. Thank you so much, Doctor, for joining.
Yeah, good evening, everybody. A lot of thanks to VOH and Pfizer for organizing this meeting. Yeah,
Thank you. Dr. Aditi Mittal, Vice Consultant, Medical Oncology, Apex Hospital, Jaipur. Dr. Jitendera Paheljani, Consultant, Medical Oncology, HCG Cancer Center, Jaipur.
A very good evening to everyone.
Thank you so much, Doctor, for joining. I thank my all esteemed speakers for joining, and now I would like to begin my discussion. My first question is to Dr. Lavneesh Goyal. So, can you please explain what exactly is breast cancer in simple terms? Also, are there any specific age groups that are more prone to breast cancer, and who is at the risk for developing breast cancer?
yeah, good evening. I think this is a very pertinent questions for us. See what has happened in last few years. I will say not years, decades. So because of the westernization, the incidence of breast cancer has increased dramatically across to all of the globe, and especially in India. So if we see the Globocan data provided by WHO in 2022, almost we have around 14 lakh new patients of cancer per year in India. Out of that, around 1 lakh 92,000 are actually cancer of breast. And in sheer numbers, the cancer of breast is the first number of cancer, number one cancer in India. And if we see the total women cancers, it is almost 25 to 26% of whole disease burden, new cases. So the important thing is that unless the awareness of cancer is there, we won't be able to actually capture a patient early and treat them early. So because the most important thing is to capture the patient early through awareness. So the common causes of cancer, see what has happened is increased westernized culture. What has happened, there is delayed, if we see the fertility issue, there is usually delayed pregnancies, early menarche, and late menopause. So amount of reproductive time increases, and that is increases the chances of cancer. Increasing age is the most important risk factor. Then comes the familial. We used to think that India, we don't have familial cancers, but I have so many families now who have BRCA1 and BRCA2 mutations. And actually, we were not testing these mutations regularly around 10 years back. From the last 4 5 years since we have started testing for mutations, especially BRCA1, BRCA2, so many new patients we are getting, and it's a hereditary cancer. The other thing is that some exposure to ionizing radiation can also increase the chances of cancer. And the most important is the lifestyle problems. Increased body mass index, less exercise, any BMI more than 30 means the increased incidence of cancer is there. Any HRT given to the patient not in a proper way. If in a proper way HRT is given, the chances of malignancy is less. But if HRT is not given in a proper way, again, it can cause increased malignancy of breast. Other thing I want to point out is that what are the decreased causes of cancer? See, I told you about these are the increased risk. So how you can decrease the risk? The important thing is regular physical exercise, and the most important thing they have seen is that low fat diet, a healthy diet will decrease the incidence of breast cancer. Other thing is that especially in a post-menopausal lady, if she takes care and does not actually gain weight after menopause, again that decrease in chances of breast cancer is.
Thank you so much, doctor, for explaining this in a very simple term for to us and to our audience. It's very helpful for us. Moving on to my next question to Dr. Aditi Mittal. Ma'am, can you please explain on that, as we talked in our introduction, that according to World Health Organization, 0.5 to 1% men also get breast cancer. Or I want to know, is it true and is it only a woman's disease or limited to them? Are these specific age group that are more prone to breast cancer in men also?
So, good evening, one and all. So, there were some technical glitches before. So, yes, hi Simran and hi everyone else. So, of course, it's not a women's disease, but it is 100 times more common in women than in men. So, there are many cases of male breast cancer. I think we see it today in day-to-day practice. Of course, the people with hereditary cancer genes, they in those people, males also get breast cancer, and of course, it's rare, but it is not like that they do not get breast cancer. The only thing is because the more awareness is more females come to you, and when it is present in males, they do not take care of them until unless it has increased in size. So, age group again, cancer as such increases with the increasing age. So, in males also, when you have increased age, then the incidence of cancer increases in those people also.
Thanks a lot, ma'am. You explained this very well. It's very helpful for our audience for explaining that breast cancer is does not only affect women, but it affects men as well. Moving on, my next question is to Dr. Jitendra. So, what causes breast cancer to develop? What are the common signs and symptoms of breast cancer that people should watch out for?
Uh, as Dr. Goyal has told that all the factors which actually increase the estrogen level in our body, basically the estrogen window, will causes the breast cells to proliferate, and the more the cells are proliferating, the more of their chances of getting any mutation which can lead to a new cell growth which is uncontrolled, unwanted in the breast, and this can lead to breast cancer. So all the risk factor what sir has told. Along with that, what healthy diet consists, I would like to emphasize on that because we are moving away from it. Actually, your diet, how much fiber it is containing, like fresh fruits and vegetables, which are locally grown and which are available freshly at our nearby farms, those are important and they should consist at least 800 to 1 kilogram in that weight. I understand that it is very tough to take, but it includes vegetables, salad, and fruits. Having said that, if any earlier we used to see that cancer is a disease of aging, but now we are seeing that these malignancies or these cancer cases are coming in the early ages. So that is probably due to our lifestyle. So any female can have breast cancer. That's age doesn't matter. But yes, having said that, it is more common in the elder patients. If any breast lump is in the breast of any female, which is hard in consistency, which is increasing in size, or which they can feel, they should consult to a gynecologist or a surgeon, whomever they are comfortable. It's not mandatory they should go to a cancer specialist for that. Second thing is if they have any nipple discharge, which is also common in the females, if they have any lump in their axilla, if they have any changes in their skin colors or any of the breast, basically if they have any alteration in the size of the both of the breast. So these are the factors which actually suggest us that there is some pathology or some excessive physiological change in the breast. It doesn't pertain that it is a breast cancer, but yes, it warrants an investigation or an examination to be done.
Thank you so much, sir, for explaining that. And signs and symptoms are the first sign that person should gets to know about that now it's time to move on or to go to a doctor, and it should be people should be aware of this. My next question is to Dr. Lovenish Goyal. So, I want to know, can family history of breast cancer add on to a risk of getting diagnosed with it? If yes, then how can individual perform self-examination first to check the signs for breast cancer? And also, why is early detection crucial in breast cancer?
Yeah, actually, very important question is that family history is very important. I was touched it during my previous talk also. The thing is that whenever there is a history of one first degree relative in your family with the history of breast cancer, the chances of breast cancer increase almost two to three fold. And if it is more than degree relatives are there, first degree especially, it is more than 8 to 10 fold. And the most common mutation we already discussed was the BRCA1 and BRCA2 mutations, not thought to be very common in our patients, but recently we have been seeing a lot. So the most important thing is that we divide for screening a patient into low risk patient and a high risk patient. High risk patient means whenever there is a family history of CA breast or CA ovary or any other malignancies in the family, especially first degree relatives. These patients have to be taught a proper breast self examination to be done at least once a month, and to be actually, if properly trained by a nurse, it is always better, or a doctor. Usually nurses will do that. We have trained nurses for that, how to do a BSc. Other thing is that if there is strong family history, usually the screening what we do is a MRI of the breast in a high risk patient. Otherwise, it is the screening mammography that is usually done. Ultrasonography is not usually done as a screening investigation, but in lot of centers, including my center, whenever a bilateral mammogram is done, usually the radiologist will combine it with the ultrasound of the breast also, because it increases the chances of getting a lesion, seeing a lesion. So this is the main one part of the question. Other question was that?
So, how can individual perform self-examination to check the signs of breast cancer, and how crucial is early detection?
Yeah, regarding the early detection part. So we divide the breast cancer patient into four stages: stage one, two, three, and four. So it has been found out that if the community screening is very good, especially mammography and breast self-examination, most of the patients will be diagnosed as the stage one stage. That is what is happening in the US and the European countries, where most of the patients, many of the patients are actually mammographically detected because they do not reach a palpable stage. Any lesion that is smaller than 1 centimeter in size, especially less than 0.5 centimeter, can be easily detected by a good ultrasonologist, not ultrasonologist, I will say a person who is well trained in mammography by certain aspects in seeing the mammography, microcalcifications, small lesion that is irregular, we see. And if you are able to diagnose a patient in a stage one disease, the practically it is curable. So once we come to a stage two disease that is more than 2 centimeter in size, or a stage three disease with lymph node involvement, then the cure rate will decrease from 100% to maybe 90% or 80%. So everyone wants a 100% cure rate or almost reaching 100% cure rate. So that's why early detection is very crucial. And breast is a superficial organ. It is not something that is hiding inside the body cavity like in the chest or in the abdomen. Like ovary, it is sometimes difficult to. If a proper community program is there and we are able to educate all the females at an early age, maybe from the school also, by community outreach program of to do a BSc to create more awareness, I am pretty sure that most of the patients we can catch in early stages. But unfortunately, because of the social issues in our community, where breast examination is not considered, it is like a social stigma. Many ladies do not come forward, especially in rural kind of population where we get delayed diagnosis.
Thank you, sir, for giving your response on this important and crucial question on how can a person is does the family breast cancer history affect and as an add-on factor to that. Moving on, my next question is to Dr. Jitendra. So, can you provide an overview of various screening methods available for breast cancer, such as mammography, ultrasound, and MRI, along with the respective pros and cons?
So, Simran, the breast is a superficial organ, as we all know. So, there was a national program, actually state program, which was run in Delhi between 2008 to 2010. In that, they actually put the holdings and they started educating people for a self breast examination. So, it is a simple procedure where a female has to palpate their breast, and there is a typical way to do it, and we have trained staff to do that. And this way, we can actually detect the lumps or the changes in the breast tissue much more early because the female is getting it checked regularly. Second method what we have, that is a gold standard, which we say is mammography. So usually mammography is an X-ray where we do X-ray two times. Basically we do with two areas. So that is the second thing. And third thing what we do, usually a complementary sonomammography we do at all various standard center where radiologists want to just characterize with the flow, whether the lymph nodes are available or not, and what is the flow in the lymph node, and what is the architecture of lymph node. Third thing what we do is basically MRI mammography. So all these three things has their indication. So self breast examination is irrespective of age. Whoever female want to do it, they can do it. For screening mammography, where we use X-ray and ultrasound together. So that is at least any female who is 40 years or more. I am talking about any asymptomatic patient who doesn't have a family history, and they should do it annually. In that scenario, we can catch the patients in stage 1 or even earlier than that, where the survival, as Dr. Loveensh has told, that it is almost under tune of 99%. So it is actually better than swine flu, COVID, and all those things. And along with that, I can underline this fact that the surgery will be smaller. We can prevent chemotherapies, we can prevent radiotherapies in those patients with the better outcome. So this is what screening will help us. Third thing was MRI will be doing. So any patient who underwent some breast surgery, and we are screening for them, like any implant placement. Second thing, any patient who has a breast history of a breast cancer. So in those cases, we have to screen the breast early. Means if somebody has a relative who had a familial breast cancer at the age of 40, so we have to screen them at the age 30. So below 40, the X-ray and ultrasound are less sensitive. So we have to do MRI screening in those patients. So these are the criteria which we use to screen our patient, and every method has its pros and cons. But still, in the community, X-ray mammography along with the sonography is the gold standard.
Thank you so much for your response, sir. Moving on to my next question to Dr. Aditi. Ma'am, how can individuals make informed choices about the best screening methods for their situation? And what role does genetic testing play in this decision? Ma'am, you're on mute.
Sorry, I'll just repeat it. So, as pointed out earlier, all females above 40 has to do their own self-breast examination. Plus, they should also self-breast examination monthly, and they should also go to the clinician, any one nearby clinician, for yearly breast examination. That is clinical breast examination, and if available and possible, they should also get mammograms done yearly. Then afterwards, of course, after 60, the guidelines say that you can do it 2 yearly also if the all the previous mammograms have been normal. So, and the genetic counseling, yes. So this is a very very important thing, and as we take more and more detailed history from the patient, and as we know nowadays that why the your relatives are dying, we know that taking history is so important. And as said, if suppose the relative has developed the cancer at 40, we should start screening at 30. So we are getting young cancers, and these people should be screened by MRI. Mammography has a lesser sensitivity in these patients, and because they generally we have to screen in very young patients, the breasts are dense, mammogram is not very sensitive, so MRI is basically advised. And genetic testing is a very very important thing, and basically armamentarium to us. And any patient with a family history has to get genetic counseling as well as a screening for different genes, so that they can.
Thank you so much for your response, ma'am. Thanks a lot. Moving on to my next question to Dr. Lovenish. So, how does timely diagnosis impact treatment options and outcomes for breast cancer patients? What are some common misconceptions and fears about early detection? Yeah.
Yeah, I think this was already discussed little bit by Dr. Jitendera and myself also. See, if we catch a patient in stage 1 disease, almost 99% can be cured. And again, many of them will not require radiotherapy, but may require if we do a breast conservation treatment. Chemotherapy may not be required if it is a ER/PR positive patient, strong ER/PR positive. Now we have some risk factor markers also like oncotype DX or some Indian markers also that we can use and we can decide whether chemotherapy is required or not. So it is always better to catch hold of the patient early. The most important thing for me always is that if I am able to decrease the amount of treatment and get a better result, and that treatment may be lesser chemotherapy or no chemotherapy at all. Plus, and if I can decrease the amount of cycles of chemotherapy also, the chances are that the patient will have less chemotherapy related issues, better quality of life with a better survival. So most important thing for me is that. What was the second part of the question?
So the second part is what are common misconceptions and fears about early
Yeah,
detection?
yeah. So the misconception, the biggest misconception I feel is that the most of the time, many of the time, the patient doesn't want a FNAC or biopsy to, and they are so much afraid अब इस गांठ को छेड़ दोगे ये छिड़ जाएगी, ये फैल जाएगी, and sometimes it becomes a very difficult to catch hold of the whole family. We have even gone to send people to my staff to their homes to get the patient back to get a biopsy done. We call them. Sometimes we will just diagnose, we'll tell the FNAC and biopsy is required. The patient will disappear. So I have special staff for that. We always have a phone number. We keep on calling them and pestering them to come again to the hospital and get a FNAC and biopsy. But last 2 3 years, this has little bit changed. So the biggest stigma is to get a FNAC and biopsy. Then the second stigma is that the rural-based ladies are sometimes afraid to tell anybody that they have got a breast. They are afraid that if they get it checked, it will turn out to be malignant. Then they have to go all the treatment, including chemotherapy, that will cause hair loss. So they try alternative treatment, alternative medicine before reaching a doctor. And invariably, they come to me in a metastatic stage 4 disease or a locally advanced breast cancer where I have to give a lot of treatment. So so basically, the main two problems we have are the society issues and the economic issues. So first is the society issues that is related to the whether the patient is afraid to tell anybody, get a biopsy done or get a diagnosis. Second is the economic issue. The patient is worried that if it is diagnosed as CA breast, I may not be able to afford the treatment, especially even in a peripheral center like I am practicing in Nisar. The whole treatment, including chemotherapy, radiotherapy, surgery, may cost around 3 to 4 lakhs. And many patients may not be able to afford. But again, because of some schemes like Aishman Bharat that has recently been launched, I have been able to treat many patients from the rural background who were not affordable. So I'm really thankful to the government for having schemes like that, where at least we can actually treat patients who are unable to afford otherwise.
Thank you so much, sir, for your response. My next question is to Dr. Jitendra. Sir, what are the most recent advancements in breast cancer screening techniques, and how is personalized medicine transforming the treatment landscapes for breast cancer patients?
See, coming to the screening things, now there are things means because the problem is in Indian community in our society, breast is an probably the most hidden part of our female. They think that it should not be touched by other male or anybody should not see it. That's probably one of the hindrance in mammography. What we feel. So there are few companies which have launched thermoscan, which some companies are getting it done, but still the data has to come for that screening, and that we have to assess that how good they are doing. Because having said that, whatever mammography we do, how much lump we will get, one third of that will still come benign. Means if I screen 100 patient, only 5 to 10% will have some sort of finding, and out of that, one third will biopsy will come out to be benign or negative. Having said that, the treatment and in advancement is so much humongous that earlier, if a stage 4 breast cancer used to come, the chances of survival will be out of 100 patient only 50% patient will see 2 year, 3 year. Now we are talking about almost 50% patients in hormone receptor positive patients which can survive in stage 4 disease without even chemotherapy because of various targeted therapy like CDK4 inhibitor, like we have now androgen receptor downregulator. Now we have PIK3C inhibitor, and now we have NGS really available where we can detect the peculiar mutation in that patient, and we can control the disease like what we do with hypertension diabetes with a single pill. Having said that, there are few targets like HER2, which is changing the domain again, and now we have agents which are effective in almost 90% of the patients, where we can at least control the disease with injections only for 2 3 years or more. So that definitely the science has come along, but as a society also we should be open towards these suggestions of what the data suggests to us, and we should be brave enough to come and discuss our problems with the experts available. Now experts are available in tier 2 tier 3 cities also, and as sir has already told, with Ayushman Bharat and various other schemes, and the treatment is also coming under cheap costs.
Thank you so much, sir, for your response. My moving on to my next question. My next question is to Dr. Lovenish Goyal. And sir, what are some of the biggest challenges you feel and the disparities in access to breast cancer care, particularly in underdeveloped areas when we talk about tier 2 and tier 3 cities where the awareness is less, where people don't know about the signs and symptoms or about the disease? What do you feel, sir?
Yes, I think I have already touched major part of this with the social schemes. So see, around 10 years back, we had some very good mission by National Rural Health Mission, NRHM we used to call. I used to go to all the local PHCs in nearby Hisar areas and take a class for the social workers, where I will tell them basic screening for oral cavity cancers, breast cancers, and the female cervical cancer. And it was quite impactful, I will say. But the scheme wound up after 2 or 3 years. So we were able to actually educate many of the social workers because of that. Because usually all the social workers are the first person to contact in a rural-based population, because many times the small village will not have any doctor per se, but it will be a social worker going from the PHC to that area and contacting them. So after that, we used to get after that many patients with history of lumps who used to be referred by the social workers to the hospitals. So the most important issue is that is awareness, awareness, and awareness. The only thing, the way we can actually get a patient early is through awareness. And I always feel the awareness should start from the school, especially for the girl child. Unless we are able to educate a young girl, maybe she is 8 to 10 years of age, about the reality of breast cancer and the breast self-examination, and to able to report immediately if they feel something has happened. See, whenever there is some change in the breast, the first thing is noticed not by a doctor or anybody, but by the person himself. And if the person is able to contact any health worker, maybe a nurse only, they may be able to get an early diagnosis. So only thing is I feel awareness, awareness, and awareness. That only will actually help us.
Thank you for your opinion, sir. So, Dr. Jitendra, what are your views on this, sir? The biggest challenges and disparities in access to breast cancer care, particularly in case of underdeveloped areas. I want to know your views as well.
See, as we are in, see, because we celebrate the World Cancer Day on 4th of February, the target of next 3 years is for all the oncological community to bridge the care gap. So, from my perspective, the care gap is in many aspects. First, in the society, we have to accept as a society that yes, cancer is a problem, because it is an increasing problem, whether it is a breast cancer or any other cancer. So we have to find out the ways to decrease it, and we should understand yes, it is curable if it is diagnosed early. So this education in the community has to be done, as sir has already told. But various way we can do it, like at HCG Jaipur, we are routinely Saturdays conducting a seminar with any samiti, Samaji Samiti, with corporate offices. So that is another way to do it. One way we are doing already with the Pfizer and new guys. Second thing, in the physician aspect also. So because cancer now it's growing up. Now, if you predict 10 years back when the cancer incidence was 6 to 8 lakhs, now it has grown to 14 lakhs, 40 lakh cases per year. Now in 2025, we are predicting we will see 18 lakh cases. So the community physician, the healthcare nurses, the Anganwadi workers should also understand that cancer is a curable disease, and they should also know the early signs of cancer. And although already NMC is trying to incorporate oncology into the MBBS and MD curriculum, to be frank, when I was doing MD medicine, I have seen many of my senior physicians, they will see a cancer patient and they will directly refer. They also were not aware how to treat it, how to diagnose it, and how to evaluate it, because we will just put it under the carpet. That's why probably I took oncology, because nobody was able to cater or bother about it. So after the physician, one more thing we should talk about, the policymakers. So the policymakers should actually encourage the healthy lifestyle. They should enhance more. In Ayushman Bharat, we can treat. We have 5 lakhs, 10 lakhs, depends on the scheme. But there is nothing which is enforcing people regarding the screening programs. We should not. We should also incorporate screening into that. So that also policymakers should see that how can cater these patients properly, early, and treat like that. So these are the gaps which as a community we should find out and we should bridge, so that with minimal expenditure we can save more life. For example, in India, one out of two patients we are only able to save. In USA, they are able to save two out of every three patients. So that 50 to 70 gap we can bridge it with the current technology and probably with the current budget.
Thanks a lot, sir. Thanks a lot for your response. My next question is to Dr. Aditi. Ma'am, how is it affecting women who is getting diagnosed breast cancer at younger age? What emotional and psychological challenges do breast cancer patients typically face, and how can these be better addressed? And how does it increase the complications in terms of conceiving or to pregnant ladies?
So yes, the breast cancer is being diagnosed not only in the very elderly females who have completed their like childbearing potential and everything. It is being now being diagnosed in very young females also. And yes, for them it is very disheartening and to be diagnosed with cancer at all, and that to a breast. It affects their body image. It affects psychologically. They are very shaken. Plus hair loss, like if it is advanced disease, then they need to undergo therapy, and hair loss is a big setback for them emotionally and psychologically. Like many patients, they're not afraid of surgery, but they're afraid of losing their hair. Yes, nowadays we have something, some machines like cool cap, but like I have too very less experience with that, and I don't know whether it works very well or not. But yes, we have cool caps. Then we have other option also. But young females, then regarding childbearing potential. So, of course, the treatment is long. The chemotherapy affects their childbearing potential. Then they have to undergo this hormone receptor positive patients has to take some medicines for like 5 10 years. During which they should not conceive. In fact, it was supposed to be like if they become pregnant, then the estrogen level in their body will increase, and then can also lead to a recurrence of the cancer or the increased progression of the disease. So one would never recommend that. But nowadays, yes, I have seen that people are, after completing their treatment, they are going to ART if needed. They have also, some people have also advocated that they should freeze their embryo beforehand or only, so that that can be used later for having a child. So yes, psychologically, mentally, emotionally, young females face many challenges, and not only oncologists, they need psychologists, dietitians, and proper support, full team support to overcome this problem.
Ma'am, my connecting question to this: have you come across any of the cases in your life when you were, looking for a patient? Patient came to you, and that person was diagnosed with breast cancer. How did you try to manage, or the emotional thing that happened at that point of time?
So yes, so doctor is only one part of the team. The team is medically, they should be medically, we are there. Then psychologist should be on the team, should be on the board. Very few centers, at least in Jaipur, have a psychologist, but it is very important to de-stress that patient. Plus the family support. The family support is like we spend only 5 to 10 minutes. Minutes with the patient, the family is like for 24 hours. Family support, how educated they are, how many things they believe, what myths they have in their family, like biopsy or anything. So that has to be catered also. The family has to be emotionally supported. The dietitian has to be on board. Everything should be in place. Then only that female is able to overcome that treatment side effects and actually lead a normal life post treatment.
Thanks a lot, ma'am, for sharing your experience with us. Thanks a lot. Followed this, I would like to continue this question with Dr. Lovenish sir as well. So, how do you think is affecting women who is getting diagnosed at younger age? What emotional and psychological challenge do breast cancer patients typically face, and how can these be better addressed?
I think the most common issue is again, as Dr. Aditi told, is that the hair loss issue. So many of time they are afraid about they are not afraid about the disease, they are afraid about the treatment for the disease. So biggest issue is that the treatment of the disease, and usually the treatment will last for minimum 4 to 6 months. So that is another duration of the disease there. So the first meeting with the patient is very important. That's what I have seen in last many years of practice. First meeting in a patient, you have to put them in at ease, and the meeting should be done with at least 2 or 3 caregivers who are sitting in the same OPD as you. And I usually explain to them that this is a journey that will take around 4 to 6 months, maybe up to 1 year, for the whole treatment to be get over. And we are with you for the whole journey. The other thing is that not to get afraid for the treatment, because whatever the side effects are there, they are for a limited duration. Suppose I give chemotherapy, there is some hair loss. The hair is going to grow back after 3 months. If we give some radiation, there are some skin changes, and that skin changes are going to go back after 3 months. Hair changes, nail changes, etc., will again go after 2 to 3 months. Now, because of the good supportive treatment, we rarely see nausea and vomiting. We rarely see any admission between chemotherapy cycles because of any febrile neutropenia or issues because of the presence of growth factors. And more use of weekly chemotherapies have decreased the asthenia levels also. Don't see much of neuropathy also. So what I have seen in last 10 years, that the advances in supportive treatment have increased so much with chemotherapy that chemotherapy has not become difficult. Only thing that emotional aspect has to be tackled in a very gentle way. Other important thing I usually tell all the patients is to make a note of questions and bring it to me, and don't look at the internet. The biggest problem for us is the internet. They will see something on the internet and come there next to your OPD cry. So I first day I tell them, please don't look for any information on the internet. For you, if you won't be able to know what is right and what is wrong on the internet, please write all the questions, and the next meeting we will discuss. So that is the easiest way, is some counseling and some time during the first meeting. So I usually try to give them 15-20 minutes during the first. and it saves me a lot of time later on. So during the first diagnostic meeting, if I am able to give them 15-20 minutes, lot of issues later on are actually saved, and my time is also saved.
That's great, sir. So, adding on to this, do you think that women who are getting diagnosed with breast cancer at a younger age is actually adding to another complication for the conceiving part?
Yes, yes, this is a major issue. Younger age is issue. The youngest patient I have seen until now is 16 years of age. So I treated that girl around maybe 14 years back. Now she has two kids also. So they are able to conceive. Usually not a issue unless there is some major problems. Nowadays we ask them for a oocyte preservation also, but it's not very easy. Many will not opt for that. So, but most of the patients will, young patient will actually have a normal pregnancy. But only issue is that if it is a hormone receptor positive tumor, sometimes I will ask them to delay the pregnancy, especially they are on some hormonal drugs.
Thanks a lot for your views on this, sir. Dr. Jitendra, I would like to have your views on this as well. How it is affecting women who is getting diagnosed at younger age? Is it adding to the complication of conceiving? And what emotional and psychological challenges do breast cancer patients typically face? And how can these be better addressed?
See, it depends on when we are getting them diagnosed. Means if it is before marriage, that things are different. Because then getting married is also a problem when we had surgery. For that, we have oncoplastic surgery, which things can be catered off so that they can maintain their physical well-being or their perspective towards their physical body is maintained. Whether means and we have to make them mentally strong and sound by answering their question, as Dr. Loveen has told that communication is the key for everything. You can achieve anything if you can communicate well. So you should understand your deficiency. If somebody is suppose sometimes we have patient 1 week I had patient who was unmarried, 1 week I had patient in the same week who had delivered 4 months back, and one more patient who was trying to conceive since last 8 years. So all of them had their own deficiencies, their own problems. Like the person who had conceived, who had delivered 4 months back, we have to told them that you should not breastfeed your child. So that was another problem. She has to take care of herself. She has to take care of children nutrition also. So each patient has their own set of problems, and we have to sit down and jot the best plan for them. That is what we do as a clinical oncology team, where we have all the experts. We sometimes involve gynecologists also in that, and pediatrician also in that. That how the best we can do. So definitely, cancer patients need financial, emotional, mental, psychological support. Along with that, we should also tell them that they should exercise a lot. So these all things definitely help them. So we should not focus only on the problem. We should see how best we can help as a team to them.
So, have you come across any of the patient who broke down when you just told them the news, or how did you handle that?
For that, a bottom line, which I already said, nobody wants to live. Nobody is happy with their life, but nobody else wants to die. So this is what human mentality is there. But yes, many patients break down in front of us. We should at least tell them that majority of the breast cancer are curable. If they are not curable, they are controllable. If it is in the curable stage, stage 1 to 3, as sir has told, within 6 to 1 year of treatment, we can save majority of them at the tune of 70 to 80%. Means I usually what I do, I give them my previous patient's number so they can understand the story better. So this is what we usually say, that you can talk to this patient. Suppose somebody older come, I will give them the number of my older patients which are 60 plus and they have taken chemotherapy. So that way they get motivated, and we usually make survivors day or patient support group. So those all things actually happens, and they do help the patients.
Thanks a lot, sir, for sharing your experience with us. I would like to add on to one more thing. I would need your opinion, Dr. Aditi Mittal, on how do you think that why are the support networks, mental health services, and survivorship programs so crucial for breast cancer patients, and how can we ensure these resources are more widely available?
So, of course, patient support groups are important in each and every disease. Like There are so many support groups in America. If you go, it is easily available. Any, in fact, for addictions also they have support groups. For cancer they have. For celiac diseases they have support group. For malabsorptions, well, they have everything. But we as a developing country lacks. Actually, we don't talk about our mental health and what we are feeling inside. That's why I think we make support groups only in our families, and we think that what people will think of us when we discuss our problems. So these are the hindrances I think in Indians, and it is gradually people are coming out of this shell and people are talking about it, and they are sharing their experiences and becoming a story or the inspiration for other patients. So yes, social media has helped us a lot, and some celebrities when they get maybe any disease, that also becomes a motivation or inspiration for the patients to get better. They see, okay, even these big celebrities are able to fight cancer. They lost their hair, and then also they gain their body image. Even I can do it. So that is, I think we as a society need to work on mental health and the support groups, and we should be the torch bearers, especially the oncologists should be the torch bearers for creating this support group, because this helps a lot. Any patient who has like people who can they can talk to and share their thoughts is very helpful.
Thank you for your view, ma'am, on this. Dr. Lovenish, what do you think? Why are support networks and mental health services and survivorship programs so crucial for breast cancer patients?
Because see what happened. See, I always tell my patient that 6 months or 1 year treatment time in a long life doesn't is not much. So suppose somebody is going to live for 70 to 80 years. That 6 months, 1 year doesn't make a difference in a long life. So the most important thing, most of our patients will get cured. So what we have to make sure is that the patient ultimately goes back to the society and the family and as an individual, as a normal patient. And there should not be any stigma attached with that. See, for last 10 years, I've seen the stigma decrease. But 10 years back, the stigma was so much like the people were afraid to actually marry their daughters, etc. To marry in a family where cancer patient was treated. But fortunately, last 5 to 7 years, it has been a lot of change in the society. The society is more open, and with that, the change is there. The patients are a treatment of breast cancer is easily accepted. A diagnosis has been easily accepted, and the patients actually are quite happy in their families. The only support they need is that they will have recurrent episodes of anxiety or sometimes bouts of depression. That during the OPD, we have to be very careful. If we feel some depression or anxiety episodes are too much, then the psychologist, clinical psychologist, and the role of psychiatrist will be there. But the most important thing, I usually do not prefer drug therapy. So I usually will ask the clinical psychologist to talk with them, and I will ask the caregivers to actually support them mentally. So what I feel as a doctor, that giving drugs for depression or anxiety for a too long duration makes them dependent on that. So the clinical important is clinical psychology, talking to the patient. I should talk, my nurses should talk, my clinical psychologist should talk, and only as a last resort, a drug should be used.
Thank you for your view, sir. Dr. Jitendra, what are your views on this? Why do you think are the support networks, mental health services, and survivorship programs so crucial for breast cancer patients? And how can we ensure that these resources are more widely available to all our patients?
Similar, it's very easy. You imagine a Viva was exam. 20 people are supposed to give an Viva. Examiner is inside. If you are not letting them talk, whether the examiners ask the different questions from everyone, but once the person come, if the questions are easy, if somebody with a positive attitude comes out, everybody feels relaxed. So actually everybody wants to know the story, what is happens, how it happens, and usually they trust somebody who has gone through it. Because sometimes patient asks, if I say there's nothing happened, you will not have vomiting. Sir, have you experienced it? So at that point in time, I think I should give them the patient where they should talk. Because those people have experienced the same thing what they are going through, because then they feel attached, So that's why these support group help them in how to what is going to happen, how to cope up with it, and what are the best strategy in personal experience. So this is how the support group help us.
Thanks a lot, sir, for sharing your views on this. I would like to request to Dr. Lovenish, sir, to please give us a concluding remark for this session. How do you think these kind of campaigns and session could help us reach to the masses, to the audience, and create awareness on breast cancer as much as possible? Because we know how crucial it is to educate our public more on about their health.
Yes, I think what we have discussed has been very fruitful. If somebody is able to attend this uh, lecture or panel discussion, the main, I think, the message is that awareness should be. And the awareness, again, I told you, starts from a very generic or school level, and it continues. The health education will continue. The health education part is very important. So there is two type way of tackling a disease: treating a disease or preventing a disease. So prevention, again, we have already discussed: low fat, high fiber diet, regular exercise, avoid excessive weight gain, and have a healthy lifestyle. These are the things, and try to have as much as organic things as possible. Other is early detection. Early detection leads to a earlier diagnosis. And how early detection is going to occur? By these kind of meetings, awareness campaigns on the country level, starting from the school, colleges. I used to go to colleges also, women colleges, we used to go and take lectures again for the awareness. So most important thing is awareness. So for me, the concluding remark is that unless we are able to educate people, educate females, and make them comfortable with their bodies, only then we will be able to achieve that.
Thank you so much for your remarks, sir. It's our pleasure to have you with us on our platform. Dr. Jitendera, I would request you to please give your concluding remarks for the session and how important are these sessions more to our audiences, to the masses, so that they can be aware of their health and take priority as the healthcare is.
See, the only solution for any problem in the world is you should understand that it is a problem. You should understand how the problem will be solved, what is the processes of it, and what will be the outcome. So these type of seminar actually in detail discuss with the expert, and we can involve some patient also if we can do it. Some patient who has already undergone it, so then probably it will impact more. So that is one more suggestion which we can put forth, that somebody who has, like, you can tell sir that their patient or sometime my patient also can come on this platform regarding the discussion, how it goes, how what happens after surgery. So these real time experiences will help us in finding the right solution to the problem, which is big and which is more important to focus on.
Thank you so much, Dr. Jitendra, for sharing your views on this, and thank you for answering all our questions. I now thank all my panelists for sharing your insights and being on a coming to a platform for educating our masses, our audience, and to make your health to spreading this message that the health is the priority. Thank you so much. Thank you, all my viewers, on behalf of joining for the session. It's an honor to have all of us on a platform. Thank you so much. And we are looking for more such sessions together.
Thank
Thank you
you.
so
Have a
much.
good
Good
evening.
night.
Thank you so much.